Okay, well, I'm Robin, by the way, Robin Jaffin. I am partners with Day Wilson with FODMAP Everyday. We are thrilled to have you all here. I'm going to hand this over to Day so I can just keep admitting people. I'm the tech person. I'm behind the scenes. Day's in the front of the scenes. So here you go.
Excellent. Welcome, everybody. We have our international audience here, and we're really sincerely just thank everyone. So Robin and I are FODMAP Every Day. We've teamed up with Joe Leech and his team at Diet versus Disease. Hopefully, you know either Joe Leech by name or you know Diet versus Disease, the brand and website. He is a dietitian. He has a team of dietitians, most of them Monash trained. He is joined today by Hanna, who is part of his team. There she is. And they are going to tell us everything we need to know about the microbiome. Now, I have to tell you, we had a couple of topics considered and it was overwhelming. You folks have questions about the microbiome. What is it? What is important for you to know, particularly if you're following the low FODMAP diet, if you're suffering with IBS, what does this mean to you? And Joe and Taylor are going to take us through it step by step. We've got slides. They're going to make it easy to understand. And just quick housekeeping, since you are here, it means you've registered. You will be receiving a link afterwards so that you can view this again at your leisure. And we are building in about 10 minutes at the end for questions. I will try and keep tabs on those. You can just put them right down in the chat function. If you're not familiar with Zoom, down at the bottom, you should see a little thing that says chat. Just click on it and there'll be an area for you to post your questions. And without any further ado, I want to turn it over to Joe and Taylor, and we cannot wait. Welcome, guys.
Oh, Taylor, you are on mute.
Both of you, got to unmute.
Let me unmute you. Ask to unmute. There we go.
Perfect. Thank you. I didn't think I don't have permissions to unmute myself, but this is wonderful. Thank you. I'm so excited to be here, everybody. And I'm just going to share my slides here so that we have a visual to go along with this. Here we go.
Before you start, Hanna, also, I just want to let folks know if you are watching this on your computer, you can go up to the little view section on the upper right-hand corner, and you can choose the standard side-by-side or gallery view. So I just want to let you all know so you can have options there.
Yeah, thank you. And I just want to point out one of the comments in the chat that said, we are not alone in this. And I agree. I think that's so relevant, especially when we see how many people are joining us today. And it is so true. We're not alone in this and we have support. And today we'll hopefully start to explore some of those. If you're here to learn about the microbiome, you're in the right place. And if you're not in the right spot, well, I think you're in for a treat, at least in my opinion. So like Dee or Day and Robin said, a few housekeeping questions go in the chat box. Some of them I might be able to answer throughout. I want it to be a little bit of a create our own adventure as we go. So if you have questions that are relevant or we want to go into a bit more detail, just let me know. I want to make sure you guys get what you need to out of this as well. I tried to put together the most common questions, or Joe and I tried to put together the most common questions we get. But if anything else comes up, just let us know as well. And okay, so let's get started here. Perfect. So what is the gut microbiome? What are we going to go through today? I'm going to start with the baseline information. I think it's important we have a good foundation so that when we dive into some of the more detailed stuff, we know kind of what the microbiome is, why it's important, and why we're talking about it. Then we're going to answer the question I often get, is the low FODMAP diet ruining my microbiome? How does diet impact my microbiome and different bacteria? And then how to maintain that healthy gut microbiome on the low FODMAP diet as well as after. I am curious, so let me know in the chat box, how many people are familiar with what the low FODMAP diet is? I'm assuming many might be, but if not, I'll do a quick little overview of that at some point too. I see a lot of yeses in the chat box, that's perfect. Okay, so a quick introduction. I see a lot of familiar names, but I'm Hanna. I've been a dietitian since 2016. I'm really grateful to work on the Diet versus Disease team. If I don't sound like myself, I have a little bit of a head cold today, but it is still me and I am feeling great and excited to be here. Joe is joining me and he is also a dietitian and founder of Diet versus Disease, and he'll be talking a little bit more of our other teammates. I do want to call out Ryan, one of our teammates is on the line today, so welcome to her. I don't think I saw any of our other teammates here, so I'll move on from this as I know Joe will talk a little bit more about it later on. So before my visual here pulls up, I'm curious, what does the microbiome mean to you? Feel free again to pop in the chat box. What do you know about the microbiome? What is the microbiome made up of, perhaps? I'll give that a second, see what your thoughts are. Yeah, bacteria in your gut, bacteria. Yes, absolutely. You guys are well versed in some of that. So our microbiome, we have a lot of different microbiomes in our body, the skin microbiome, oral microbiome. Today we're talking mostly about our digestive microbiome. It's important to mention that all of these microbiomes do interact with each other through different axes. However, our digestive tract microbiome will be the one we're talking most about. I saw someone else put yeast in there. Yes, our microbiome has bacteria, viruses, fungi, archaea, and many humans have parasites within our digestive tract too. Sometimes this can be problematic, and sometimes we might live our whole lives with these without them being problematic as well. And so archaea are also a part of our microbiome. A little fun fact about me, I love microbiology, and 10 years ago when I started learning about archaea, I just loved it. And so I'm determined that one of my children will be named Ari after archaea. So if you ever hear archaea, you can think of me. So, oops, slipping ahead here. So one analogy I like to use here when I'm talking about the gut microbiome is a city. The reason why is every city is unique, whether you're in New York, Toronto, Las Vegas, Sweden, wherever you are, all the cities are a little bit different. However, a lot of the components and pathways within these cities and how they function are similar. So although their makeup might be different, we might have different living beings within our cities, so firemen, doctors, dietitians, carpenters, postal workers, they all have different roles and functions in different amounts. They're fairly resilient in terms of their pathways if we have more or less in terms of our in terms of demand, we're pretty resilient, our cities. However, with drastic changes and stresses, sometimes these systems go a little bit out of balance. And when these go out of balance, things start to break down or things don't function as well. Perhaps things become a little bit more stressful with these systems. And similar to our microbiome, each of them are unique. So we can't compare, say, New York and Toronto's microbiomes or Taylor and Joe's microbiomes, but they're made up of similar pieces or components, and we want to keep these in a happy balance. And when they start to go out of balance, it's not that we can't get them back there, but we have to find ways to make these processes work again and get it into a balance that works well. Before I move on, does anybody have specific questions about that? Was that analogy helpful? I'll be using it a few other times, so if it's not, I'll try to pick up a new one, but let me know in the chat box just to make sure you're all with me.
Taylor, can I jump in and make sure that you're sharing the correct screen? Because maybe you have two screens. The one you're sharing is not like in presentation mode.
Ah, okay. Let me see here.
So maybe you're sharing the other one.
I might be sharing my note slides. Thank you, Joe, for letting me know.
Yeah, I wasn't sure though. So
You're like,
wait and see. But I just wanted to say hi, everyone, quickly. And also, we want to make sure we cover your questions. I mean, I know we're a limited time and we want to be realistic and try to keep within an hour. But if you do think of a question or is something pressing you really wanted to ask, I'm just going to make more work for Robin, but write it in the chat and Robin is going to try to highlight it or copy paste it or something so that we have a fast way to sort of try and get back to those as best we can. So don't hesitate to write them in the chat.
I'm taking notes of them and we can get to them at the end when we have time.
Day, perfect. Okay.
Perfect. Okay, let me try this again. Are we seeing slides this time?
We see the first slide. Yeah, now we do.
Beautiful. Okay. Thank you. Okay, so let's keep going through here. So you might have missed my original little layout here. This was the original little diagram surrounding the bacteria, archaea, and viruses that I was talking about in our different microbiome as well. So that visual is sometimes a nice one to take a peek at. Moving on to, why does our gut microbiome matter, and why do we care about the health of these living cities within us? So does anybody have any questions about, or any comments maybe on what you've heard about why the gut microbiome matters? I'm going to try to open up my chat box so I can see too. So yeah, it's our second brain. So I'm seeing some of those comments pop up. So in terms of our gut microbiome, it in a sense plays a lot of roles in hormones. And in fact, there's a lot of evidence surrounding an increase or an impact in different hormones within our body. The research is a little preliminary in some of the neuropsychiatric conditions that can be associated with shifts in our gut microbiome. So some individuals' microbiomes will have more or less bacteria that can be associated with different conditions as well as immunity or our gut tissue. So our gut tissue isn't specifically our microbiome, but it's a part of our bacterial health, or that mucosal lining, and it plays a large role in this microbiome health within our body and our immunity regulation. And so we often see with this microbiome imbalance an increase in potential contraction of different illnesses or sicknesses. And this might be something that people notice after they're aware of it, is, oh yes, I've noticed that when my microbiome's off, I often contract a lot more colds or illnesses, that type of thing. Digestion, and this is one we often know, shifts in our microbiome, research is showing can be associated with IBS, IBD, and a lot of different conditions, digestive health conditions as well. This also impacts our motility or movement through our digestive tract, how we break down food, how we synthesize different vitamins. And there's some research surrounding vitamins, such as having adequate amount of vitamin C and vitamin D and the B vitamins as well, and having adequate amounts of those through food can help with our microbiome diversity, which is really helpful as well. And then of course, our cardiovascular health. And so there is research that shows that our healthy, resilient microbiome can be associated with better managed cholesterol, so it reduces our risk of dyslipidemia. It also can help reduce our risk of diabetes, as well as some other chronic health conditions. Again, this research is a little bit chicken and the egg, in the sense that we see these correlations in populations, but we can't always determine cause and effect in these populations in some of that research, especially since sometimes we will see shifts in this bacteria before or after as well. Does anybody have questions specific to this? I'm just looking through. I see some questions that we can answer at the end. Someone says, why aren't FODMAPs getting the attention they deserve? Good question. Okay, so is the low FODMAP diet ruining my gut microbiome? So I think the word ruining is a little bit harsh. It's not necessarily ruining our gut microbiome. However, any dietary changes starts to affect our microbiome or bacterial diversity within about 24 hours. And then in about 4 weeks, we can start to see much more significant shifts. Now, this can be for better or for worse, depending on what types of things we're doing. So I would never explicitly say the low FODMAP diet is ruining our gut. However, there are some factors that we want to be aware of to help maintain the health of these cities or these internal cities while we're doing the low FODMAP diet. I saw a lot of yeses when I asked if people were familiar with the low FODMAP diet, so I won't go into too much detail there, but for anyone that might be new to it, the low FODMAP diet is reducing fermentable compounds to help with managing IBS and functional bowel disorders. It's an elimination phase followed by reintroductions, and the reintroduction phase is sometimes the one people are most nervous about. With the low FODMAP diet, we see fabulous improvements in symptoms. However, what the research also shows is that we can see reductions in some healthy bacteria, and we can also see increases in some bacteria that we want less of. And again, this is a little bit of that chicken and the egg in the sense that, is it that we are reducing a lot of the good components with the low FODMAP diet as opposed to the low FODMAP diet itself? So we'll talk about some ways we can help counteract this when we're in that low FODMAP phase. This is also why we don't want to be low FODMAP necessarily forever, and why that reintroduction phase, one reason, can be really helpful as well. Probiotic administration is another piece that can sometimes be helpful in partnership. I'm not going to dive into details there, as that could be a whole nother presentation in and of itself. With that being said, however, it can be an important piece, and more doesn't always mean better, and more strains doesn't always mean better. And I say that because sometimes we don't always know what to look for when we're looking for the right thing. So seeking support with that, I do encourage. Okay, so fiber. I know lots of people hear this all the time. It's eat more fiber, eat more fiber. Okay, what does that actually mean and why? And I think the why is really important. So fiber is a really important form of prebiotics within our digestive tract. Not all fiber is prebiotics. We have a lot of different types of fibers that fall under this fiber umbrella: soluble, insoluble, prebiotic, and resistant starches. I like this diagram because it helps break down that lots of these fibers are consumed by our prebiotics, or those colonies within our digestive tract. And then when they're consumed, they have byproducts, or they have kind of waste as well, which helps with our maintenance of our digestive tract. So that butyrate is a byproduct. It helps with maintaining that nice healthy gut lining and gut mucosal lining, and it helps with our overall digestive health. And it's this nice cycle that occurs. So some different types of soluble and insoluble fibers that we can get on the low FODMAP diet. And these are low FODMAP sources. They're not no FODMAP sources. So it is important. That portion matters. And I know sometimes when we go low FODMAP, we get really nervous to have symptoms. So we try to avoid every single FODMAP possible. But some small amounts in low FODMAP portions can help with maintaining this microbiome diversity. So this might include having oatmeal. So quick oats are actually higher FODMAP than steel cut oats. So we might have a 1/4 cup or 1/2 cup of oatmeal, again, depending on the type we're having, to keep our fructan load low, while also still getting some of those fibers. So that might be one example. If we're having trouble getting enough on a low FODMAP diet, we might want to explore low FODMAP fiber supplements. I like food first if we can, but things like acacia or psyllium will sometimes be a nice fit for people too, depending on their unique digestive tract. And then one last thing about the resistant starches is some foods we can actually cook, cool, and then reheat and eat, and we'll actually have an increased amount of resistant starches. Things like rice and potatoes are really good examples of those. Probiotics and fermented foods. I said I'm not talking too much about supplements, which I will not, but I am going to talk a little bit about probiotics and fermented food from food sources. This diagram here is specifically from a study on dairy sources, so a kefir source of probiotics. There are both dairy kefirs and non-dairy kefirs, so water-based kefirs that contain different probiotics and fermented foods. There is great evidence that this can help support a healthy microbiome. With that being said, during the low FODMAP portion of the diet, it's hard to get a lot of these because a lot of them are higher FODMAP. However, there are some low FODMAP kimchis, and there are some low FODMAP kefir options or lactose-free yogurts that can be incorporated and can help with IBS-C, constipation, or IBS-D, while also maintaining some of these nice healthy bacteria in our digestive tract, which lead to this nice healthy mucosal lining and microbiome environment here, which leads to some of those beneficial effects we talked about earlier as well. Probiotic survival tends to be optimal in some dairy sources as well, so the lactose-free yogurt and kefirs, but you can also get it from things like sauerkraut or kimchi. Again, portions will be important there during incorporation into your diet as well. Any questions about that? Oh, someone said, are resistant starches something positive to have more of or not? Yeah, great question. This is something that incorporating more of can be really helpful. Again, I don't want us to be all or nothing in the sense that more doesn't always mean better. We want to have still a variety of different foods in our diet, but having more of those can be really helpful for our gut bacteria. So that's a wonderful question. And what do you recommend for those who can't eat dairy? Great question. So although some people are intolerant to lactose, some people are intolerant to whey or casein and can't have dairy products. You can do the water-based kefirs, you can do some sauerkraut, you can do some kimchi. There are low FODMAP versions. Just make sure to check with the label to make sure there's no garlic or onion in those, because that's a common ingredient I'll find in those as well. Okay, so plant-based fats. This is a really interesting study from 2020. It's pretty large scale, and it looked at the difference in individuals that had high amounts of plant-based fats or high amounts of animal-based fats. Again, I want us to be cautious to stay away from all or nothing thinking here. So it's not that you can only eat one and the rest is bad. We still want to have a variety of different nutrients, and different foods can still be a part of an important balanced microbiome. However, I think it's important to be mindful of how are we getting these plant-based fats into our diet. So during the low FODMAP diet, this might be a beautiful time to incorporate extra virgin olive oil and garlic infused or onion infused olive oils. As we know, garlic and onion are very high FODMAP, and so people ask me why they can have these infused olive oils, and the answer is because FODMAPs are water soluble, and so they'll leach out into water, but they're not going to leach out into oil because they are not fat soluble. So when we put garlic or onion into this, those compounds don't leach out, and so we are consuming that product, the olive oil, with the flavor without the FODMAPs, which is great, and it's a great way to get those plant-based fats, which we see an increase in those bifidobacterium, lactobacillus, and some of those short-chain fatty acid-producing bacteria, as well as we see a reduction in some of the bacteria we would like less of as well. And then again, with the animal-based fats, it's not that those are necessarily something we can't have, it's how do we incorporate it in a way where we're also getting some of those plant-based fats in our diet as well. Wonderful. And let's see here. So I'm going to give Ryan credit for this one because this is one of her lovely phytonutrient spectrums. And I really like this one because it speaks to some polyphenols and phytonutrients. And the ones that are crossed off are actually high FODMAP. The ones that are moderate FODMAP or low FODMAP are still left there. And so with these different foods, these different phytonutrients and different antioxidants have a lot of different benefits within our body, but also with supporting our microbiome, our bacterial health, and the cellular health within our digestive tract. And so sometimes it can be helpful to take a look at, am I eat the rainbow? I know it sounds cliche, but am I getting some different foods from different places? And if I am I getting a variety of different phytonutrients or different colors, different polyphenols and phytonutrients as well? And so sometimes it can be helpful to have something to take a look at. Again, you'll have this presentation. You can look back and maybe check a few off and see which ones am I getting, which ones maybe am I not getting within my day-to-day as well. And I saw someone comment saying garlic is listed as high FODMAP, so confusing. You're right, garlic itself is high FODMAP, garlic powder is high FODMAP, products with garlic is high FODMAP. It is confusing at times, and that is where we are here to help support you because it is hard to know it all and kind of sort through all of the pieces and the science behind it. Okay, so what next? How do we fit all of these pieces into our day with our unique health profiles? And there's a variety of different ways we could perhaps do this. Again, one way is solo. We can try to pull some of these pieces. We can implement it. It's possible. We do sometimes have to have a little bit more time and commitment, that type of thing. We can follow different guides on the internet. There's lots of good resources, and we want to make sure that we're taking a peek at what is reliable information. And of course, we can look at a little bit more personalized guidance. And I'm actually going to hand it over to Joe, and I will stop sharing my screen so that Joe can have control of that.
Thanks, Taylor.
Yeah.
So isn't Taylor, she's a Canadian treasure. I say. I'm super fortunate to have her on the team. She's super smart. One of the best dietitians I know. So thanks, Taylor, for that info. And Ryan's on here as well, and she's also amazing. I'm going to get her to help us with a presentation next time for sure. So who's feeling confused or overwhelmed with all that information or what to do with it? put a yes. I can see hands up. Put a yes or no in the comments, because it's like, Taylor, you just told me like 50 million things. I can't pronounce those words. Like, how does it apply to me and my situation? And that's what we want to try to help you answer. And obviously, that's what, you're not alone. You can see what everyone's putting there. So I'm going to share my screen. Before I do, Day or Robin, do you want to jump in? Do you have anything to add? Do you have any questions? How are we going for time and all that?
Time-wise, we're not even halfway, or just about halfway. The one comment I want to make is that I'm looking at some of these questions, and there's two things that jump out at me. First of all, there's a lot of people, and this is not, just so all of you know, this is not surprising to any of us here. There's a lot of people who have been put on the low FODMAP diet who have been given hardly any information at all. So, Joe hears this every day. I hear this every day. So know that you're not alone. The fact is that every single one of you has a unique situation, right? So some of you have said, I also have SIBO, or I also have diverticulitis, or I have diabetes. This is why you need to be working with a dietitian, because every single one of you has a unique situation. We don't want to crowdsource your solutions on social media, because people haven't met you in person. They don't know your whole medical history. So we're going to take care of you and give you information that you need to find the help that you need. So that's the first thing. People are just scrambling. That's not surprising to me at all. I think the most there were two questions that jumped out. Poor Darlene said she's on the low FODMAP diet and she's only eating 5 foods. Darlene, there's help. There's much more out there for you. We can help you expand your diet. We can help you stay symptom-free. So just stick with us to the end of the seminar. But really, that's it. People are commenting on their personal situations. They want information. The other thing that came up a lot was probiotics. I don't understand. Why can't I have probiotics, or can I, or can't I? So, Monash suggests that you do not use probiotics during the elimination and challenge phases, because it can cloud your reaction to FODMAPs. That's what you're trying to assess at that time. Mm-hmm. That said, if your particular medical situation warrants it, a dietitian who's working with you might make recommendations to take probiotics. So that's where it gets confusing, right? We don't want you to just go out and go to the store and buy probiotics and start taking them. We want you to work with a medical professional who's going to look at your individual situation and make the right recommendations.
Yeah, so true. And then there's types of probiotics. Oh my goodness, many types. And some of them are good and some of them are not. And that will influence what happens. And then to circle back to the question you said earlier, just quickly, if you're eating 5 foods, I mean, that's one of the main problems with the low FODMAP diet, but that's also why it's supposed to be a set period of time. And then you're supposed to re-challenge in a protocol and it hopefully expand your diet to what it was, even maybe more once you've figured out the triggers and stuff and eating even more foods. The fact that it's so restrictive is one of the main reasons it's not healthy for your microbiome and that balance of the gut bacteria. It's so restrictive that you don't get all these different nutrients that Taylor was mentioning, for example. And then jump in, Taylor, if I missed anything. But that's part of the issue. If you're so restrictive on the FODMAP diet and you're that restricted for a long time, things won't get better in that environment that you're making, unfortunately, despite your efforts. Yeah, cool. Okay, so I see some. How do I find a dietitian in those FODMAPs? Yeah, I mean, there are a lot. I'll go into what you should look for. That's kind of what I'm doing. And I see some Kathleen's here. She said she's one of our clients, and Christina as well. So thank you guys for that. So I'm going to share my screen. Can you see this? It says what next? Yeah. Okay, good. So I'm just going to go through this. So Taylor already said this, right? You can do this solo. So you can go and look online and try to figure out stuff yourself. Of course, it's possible. There's people who've done it. It takes the longest time. That's the reality. I don't know how long it will take, but it takes a long time. You can follow guides on the internet and things. They're generic, okay? So we just talked about how the microbiome is unique to you. And so if you've got this unique issue, particularly with your unique circumstances, and you follow something generic, well, there's only so much that can happen. And chances are what you're following is not really going to be spot on for you. And then the other option is personalized guidance with a specialist team or a dietitian. And so obviously that's what we do. What I'm going to do is just quickly explain to you how our system works, why it's different. What I hope it brings to you is at least clarity on like why might what you've tried so far not be working, or why you might be feeling confused and overwhelmed at the moment with this information, with other information you read, and why you've not been able to apply it to yourself. And then also by the end, hopefully you'll be able to at least be able to make some, do some critical thinking around this, about who is a good practitioner that I could work with, who might know what they're talking about and who may not. So that's the goal. And then of course, I'm going to explain what we do, and then there's going to be details if you want to look into that. But I genuinely just want you to learn what to look for, what works with digestive issues, what we see working and how it needs to be set up. And then you can go and do your own research and make your decisions there. So this is a little chart I've made, and this was at the recommendation of Day and Robin. They said that this would help. Visuals always help, of course. And basically what I'm going to look at quickly is why you want guidance from dietitians, why you want the approach you do to be personalized to your needs, so not just general advice, and what high-level holistic support means exactly. And where we lie is sort of at the intersection of these things. Does that make sense? That's what the diagram is supposed to represent, okay? So step one, how our system works. So we're providing expert guidance so you receive the correct information, and you're not doing this alone. It's pretty self-explanatory. But if you've got a diagnosis for your issue, okay, you have other health aspects to consider. Maybe it's diabetes or metabolic syndrome or an autoimmune issue, hypothyroid, we see a lot. Maybe you have weight loss or weight gain goals. I don't know, but if you've got other aspects to consider and you've got to balance things, you take medications, other medication. It's important to work with specialists that have that deep experience. Maybe you aren't even sure what's wrong. The doctor sort of did all the tests and were like, well, we didn't find anything physical, so you've got IBS, and go and look it up, the FODMAP diet, right? So if you're working with the right people, it just ensures you receive the correct information and treatment. I feel like when I first started online, that was one of the main things I was trying to do, just put out correct information, because I know there's so much stuff out there, and it's hard to decipher what's real and what's not. So analogy I like to use is in terms of working with someone who's a specialist. You wouldn't go to your local doctor for surgery, right? You go to surgery for surgery, as they're the specialists. And in the majority of cases with the people we see, and for a lot of you probably on this webinar, you need to work with a specialist, and one that has experience. So if we build on this analogy, let's pretend you were getting surgery, right? Would you prefer the surgeon who has 10 days experience or 10 years? You can write in the comments. Would you choose a person with 10 days or 10 years? And obviously, the answer is the 10 years. We want the person with more experience because they're more likely to be able to resolve our issue based on their previous knowledge, right? If we build on that further, would you prefer the surgeon working on their own or part of a team? They have the anesthetist, they have the nurse, they have whoever before and after. Which would you choose? Of course, we would choose the team, right? And this is what I'm fortunate to have, and we've built together. And we have a consulting team. Together, we have over 50 years of experience with gut health and digestive disorders. And it ranges from not only the nutrition component, this is really important, but the psychological mindset component as well. And if you've heard of the gut-brain axis, right, I think a lot of people said they have, then I'm going to touch on this in a moment. I'm going to talk a little bit about the gut-brain axis. But our team also has this component. So we're not just nutrition and dietitians. And this is a really important part in a lot of our symptoms, especially with digestive issues. And just quickly so you know, we have myself. I'm in Stockholm in Sweden. I am Australian, if you're wondering about my accent. If there's any Aussies on here, please say hello in the chat. I highly doubt it. It's like 3 a.m. in Australia, but who knows? I did see a lot of people in Europe and UK. That's cool. Beth's in Portugal. Tim's in Brisbane, Australia. Taylor is in Canada, Alberta. Rachel is in Cleveland. Nick is in Madrid, in Spain. He's Australian, but he's fluent in Spanish, and he's studying medicine in Spanish. Blows my mind. Erin is in Brisbane. Ryan's on here. She's in Cleveland. Correct me if I'm wrong. Columbus, Emily, so she's nearby in Ohio. Amy's in Montana, and Jay's in Brisbane. So we've also got people around the world. So that means we work with people in different time zones and stuff. It's very cool. Now, so I've told you about step one. So just like you want to look for people who have expertise in this area, okay, and experience. Step two. Now, our approach is personalized and tailored to you, okay? So what we do is like we're personalizing what Google can't, okay, when you're going and searching for things. There's only so much you can type, and Google's always going to give you the same articles from Healthline and things like that. We're personalizing what your doctor didn't. And I love doctors and I love medicine, but the reality is your doctors don't have hardly any nutrition training. They especially don't have digestive health training unless they're a gastroenterologist, right? But your GP, your physician, they don't have time. It's not that they don't want to help you. They don't have the time. They've got back-to-back appointments all day. So they can't do it. But that's what's needed, you see. Supplements, medication, probiotics. It's not personalized. It's not a long-term solution. Taking fiber supplements or, medication, laxatives or whatever it is for your issue. It's not the long-term solution. I think most people can agree with that one. Now, why is it that important? This personalization I'm talking about with digestive issues. We've been talking about it. The microbiome for starters. So this analogy I like, Taylor. No two microbiome, no two people have the same microbiome balance or makeup. It's the same as our fingerprints. No two people have the same fingerprint, which is a really interesting fact. And it's the same with the microbiome. Like they've done research. This was a news release from Harvard. Personal microbiome shown to contain unique fingerprints. We have lots of different studies that have since supported that. And this one I found really interesting was unique gut microbiome patterns linked to healthy aging, increased longevity. So just when Taylor was touching on how microbiome impacts those different aspects of health, and therefore healthy aging, they're looking now at cognitive function as well. Just like living longer, but healthier and longer.
Quality of life.
Yes. So super interesting. So then why are we looking for generic one size fits all approaches for something that is just, the more we look into it and learn about it, the more we realize it just doesn't work. Okay. So yeah, that's how our approach is personalized and tailored to you. So if you work with us, we're truly getting to know you and your situation, and your situation being other health circumstances, what you're doing for work, what your lifestyle is like, how stressed are you, anxiety, etc. We do that because to repair the gut and help you reach your health goals, that's what it takes. If we could do it in another way that was like just a generic thing, then we would do that, right? But that's not how it works. It's the same with the test, these tests that sound so innovative, like I have a friend that did like the hair test. They send in a hair sample, and from that reading, they can give them all sorts of very specific recommendations. Even the gut microbiome tests, while yes, we know all these changes affect us, but we don't know specifically what that balance needs to be. The only way we can know is to actually add and subtract things and engage your response. There's no like one test you can do and it's like, oh, that's it. This is what I have to do, and I'll just do that forever and live happily ever after. So we know that no one actually eats like that. So hopefully that makes sense. If you have any questions, you can put them in the chat box. Last thing, this is the last thing. Step 3. We get results by providing high-level support that's holistic and convenient. And this is really important. So if you're thinking about jumping off right now, just hang on for a second. This is really important. High-level support and holistic and convenient to you. So when I talk about holistic, I don't mean holistic like woo holistic. We are evidence-based, like science-based. I mean holistic as in we're coming at it from all angles, looking at all things that would potentially have an influence on what's going on and why you're feeling the way you are and why you're not getting better. So we're not just doing nutrition. We factor in the key role our psychology plays in digestive health outcomes. And here we're considering the gut-brain axis. So who's heard of the gut-brain axis? You can put yes or no in the comments. I'd be really curious. I know people heard of the gut microbiome, the second brain. Gut-brain axis is something that everyone should be aware of. Just knowing about that changes a lot of things. So I'll stay here. So the gut-brain axis, to put it quickly, it's connected. You have it's called the vagus nerve, and it connects your brain to your gut. And it's the reason, like, you feel, when you think you lost your wallet or you left your wallet or your phone somewhere, where do you feel that physically, right? You feel it in your stomach. That's literally your vagus nerve activating from the brain down to your stomach. Or like when you used to run a race when you were little and you were nervous, right? You got butterflies, or it might be public speaking. That is your vagus nerve, and that's what we refer to the gut-brain axis. But basically, if you have chronic stress anxiety, a low grade, not like I lost my wallet feeling, but a very low, I'm always, I'm kind of worried all the time. We don't even realize. It is always activating the digestive tract, and it can be sort of tense and fast, and people get different symptoms that way. But for a lot of people, that is actually what is going on or part of the problem. How do you fix it? How do you treat it? One of the ways is called gut-directed therapy. Okay. Now, research shows gut-directed therapy can be equally as effective as a low FODMAP diet for relieving digestive symptoms and IBS. Remember, a low FODMAP diet, they've done a lot of studies now, good studies. 70 or 75% of people, maybe up to 80, experience relief. So there's 1 in 5, 20%, who do not. So what's going on there? With gut-directed therapy, let's just come backwards. It's the same. They've done all these tests, well-controlled trials. 75 to 80% of people respond to this as well. So we know there's huge overlap, but then there's still 20% or something that don't respond. What we found is if you have the ability to offer both to clients, assess what they will need and offer both, you can fill in the gaps where the FODMAP diet doesn't work on its own, or gut-directed therapy doesn't work on its own. But for some people, it's a blend of both. Some only need one or the other. So hopefully that's making sense. I think I have it in a point here. But yeah, it's increasingly clear patients have far better outcomes when they have access to an effective diet protocol or an effective mindset protocol. So in many instances, we'll combine them both. In many instances, you only actually need one or the other. And by doing that, we can effectively help 90, 95, 99%. I'm not going to say 100%. There's always exceptions in different circumstances. But this is what I'm talking about, a holistic approach. Okay. So when you're looking for the practitioners to help you, if you identify as someone who experiences anxiety or worry or stress often, and you think, oh, this seems to affect my digestive symptoms, or it seems to affect my energy, which is like indirectly related. If energy is a big one for you, I want you to think about this. If you go on vacation and your symptoms are different, even though you're eating like things maybe you shouldn't be or whatever, but you feel better on vacation, that's also a big clue that your regular lifestyle with the stress and anxiety there, that it's an indicator that gut-directed therapy would be something you should consider. Okay. So I want a lot of people just to be aware of what that is, because no one talks about that. We talk about low FODMAP diet. We don't talk about gut-directed therapy. Just quickly, gut-directed therapy, it's evidence-based and scientific. This was just a couple of the reviews. They've done reviews, analysis, etc. So I'm not talking woo-woo like cognitive behavioral therapy. Those other things are very proven. They're very effective for the right people. So yeah, just to recap, the last thing was what we're doing is convenient and on your time. So this was about the holistic support. We're providing support whenever you need it and wherever you are in the world. And it's at the tap of a button, because we do it online. We do it with Zoom like this, and we use some other apps and things. Because of that, you don't have to drive anywhere or spend time, and it's convenient, right? Like for me, if I think about going to the gym, say my goal is, I want to go and exercise 4 times per week. If I know myself, if the gym is more than 20 minutes travel time, I won't do it. I just will not make time for it, or I can't make time in my schedule. If the gym is 5 minutes or around the corner, I'm so much more likely to go. So if that's you, think about setting things up so it's like in your favor, the way you're setting up your life. And we don't want treating your issues to cause more stress. That would be counterintuitive to what we're trying to achieve. So that's why we do it online. So it's just there for you when you need it. We have the team that's all around the world, so someone's always awake, and it's their work day somewhere. So they can answer you. We can help you whenever, and that's what I mean by convenient. Okay, and just be thinking about that. Is it close? Because for a lot of people, the dietitian close to them or whoever they have access to, the health practitioner, they may not have the knowledge base they need to help you. But there is other options. You can go online, and that's kind of what we do. So hopefully that makes sense, everyone. So to tie it back, right? It's guidance from expert dietitians and health professionals. It should be personalized to your needs, and you should have high-level holistic support. Okay, and if you get these things, then you're just about, I can safely say that you are going to make a lot of progress. And for almost all the clients, they're in such a whole different, better place afterwards. And so we're trying to be at that junction there.
So Joe, I wanted to just interject because we're coming up to the 10-minute mark.
Yeah. Okay.
And I just wanted to say, all of us who work in this field every day, I mean, sometimes, we're not coming to this new, right? But a lot of people who are seeking relief are. And what I wanted to tell everyone is, people don't understand why they need to work with a dietitian. Mm-hmm. And certainly prior to 2015, when I was diagnosed and introduced to the low FODMAP diet, I didn't know what a dietitian was. And a lot of people don't. We think of a lot, at least in the US, a lot of people think of a dietitian as this person in the hospital, and we're not really sure what they do.
They serve food, right?
Right. We just don't really know what they are exactly. Yeah. And so people have been asking a lot of questions in the chat. Why doesn't my GI know about nutrition? And why did my GI recommend this or that, or prevent me from eating this or that? So I hope what you guys are taking away, you attendees, what you're taking away from this is understanding. So dietitians, their job, right? The GI's job is to help get a diagnosis for you. Right. And they're really good at that. But their job is not to work with you every day to help you understand all of your food choices. That is what the dietitian is there for. They're there to sit down with you to get the medical information that you've already accumulated from your GI or your GP, to look at your unique situation, to help you figure out your triggers so that you can eat without triggering IBS symptoms, to end up with a positive relationship with food. I mean, that's really important, right? A lot of people have said, I've been on the low FODMAP diet for a year and I'm scared of starting the second phase. That's what a dietitian can help you with. So I think just understanding that there's a real reason for being, for all dietitians to be there, that's what they're there for. They're there to help answer all those questions that you guys have posted in the chat. And they're there to actually help you figure out your personal relationship with FODMAPs and how you're going to get to that place where you're feeling better.
Yes, thank you, Data. Yeah, it's we should start with that, really. Basically, a nutritionist has nutrition training. A dietitian has done medical nutrition training. So we work in hospitals and we work closely with the doctors, and we're doing the medical nutrition aspect, basically. So that's a short way to say the difference. Anyway, I'm finishing up. So we've got, if you want to learn more about our stuff, you can go on the website. I record testimonials with whichever clients are brave enough to do that, right? Of course, we've worked with so many people. We must have at least 120 of these videos. Most people don't want to go on the internet and talk about their digestive issues, where it's like on the internet forever. But of course, some people do, and we do videos because they can't be faked. Images, I don't know. I want you to hear people's stories. So there's those things on the website. If you're interested to learn what we do and the options, you can do a free call with us, and we just sort of learn your situation, explain how it works with us. If you're not a fit, we're not going to, try to sign you up, of course. So we don't want people to pay for things that is not going to help them. But if you're interested to learn more about how it works, you can go to this website here. We'll send it in the email as well later, dietversusdisease.com/book. It's VS dietversusdisease.com/book, and it will take you to a calendar. And if there's spots there, then you can just book a free call with us. So shall we go to questions? Did you round up some of the main questions? If anyone has any extras, they can...
Well, I'll tell you, the one that fascinated me the most is Laura wants to know if there's any connection between smell and triggering IBS symptoms. And I have to say, I've never even thought of that or heard anyone ask that question. So do you have anything? Do we know anything about that?
I might interject if I may. So I haven't seen a ton of research specific to smell, but I have seen a lot of research related to visual cueing with food or even exposure to food before we've even eaten it. And this is often related to learned behaviors with food. So our brain has a lot of different neural pathways. And if we often associate certain foods with symptoms, this can sometimes be a trigger for individuals. This is similar to persistent pain or chronic pain pathways as well. And so when we have a learned association with a food or even sometimes digestion overall, we can sometimes trigger symptoms before we even, or just thinking about food can sometimes be a trigger for individuals. This is also where some of that gut-brain axis work comes in and where gut-directed therapy can be really helpful. When our nervous system is heightened right up, we can react through that nervous system pathway when we've just smelled the food, for example. So this is one reason. There may be other ones I'm not aware of, but there is research related to that hypersensitivity and that neural pathway with persistent pain within our digestive tract or other areas related to exposures to different foods.
Oh, that's fascinating. That's really interesting. We had a couple of questions about fecal implants.
Yes, and so in terms of fecal implants, I don't know if Joe wants to hop in as well, but there is some research related to this. And there is some research around replacing some of our healthy bacteria within our digestive tract. Again, a lot of places aren't medically practicing this necessarily. The other tough thing, like Joe and I had mentioned, is with everyone's microbiome being different, we can replace healthy bacteria in our digestive tract and hopefully maintain the health of these bacteria, especially if they've been really depleted, for example. However, is this the end-all be-all for everybody? Not necessarily. Is this the answer? Not necessarily. It really depends on the condition and the person and what they're looking on balancing. Additionally, there are sometimes lifestyle ways we're able to do this without that intervention as well. But Joe, do you want to say anything on that?
No, I think you've covered it. I can see some, like, at least the recent questions. I could do like a quick fire DD if you want to like answer people really fast, if you like, or I can do it afterwards if you had other questions. If those people who did ask a question, I will get to you.
Well, I did have a couple of questions. The connection between brewer's yeast and IBS. Is it a recommended, something that you recommend? Again, it's probably going to be an individual thing, I suppose, but that was a question that came up a couple times.
So brewer's yeast isn't one that I would recommend specifically taking. I'm not sure if that's the question for managing IBS. Again, our microbiome does have a fungal balance that's important, but I wouldn't recommend taking that if that was the question. Another question I sometimes get related to yeast is with true sourdough, is low FODMAP if it has yeast in it? That's sometimes a quick sourdough, so it's not actually low FODMAP. I think I saw a question in there about that related to yeast as well. I'm not sure if that for sure answers that question.
Well, the yeast is going to ferment, is going to make more fermentation in your, if you're consuming it. In sourdough, it's done its fermentation already. The gas and whatever is produced, and it's consumed. The yeast has consumed a lot of the FODMAPs in the bread, and therefore when you eat it, it's like it doesn't trigger as many issues. But if you're actually eating food and eating or consuming yeast somehow, then that process is going to occur inside you, which we don't want.
Right. Another question that was very early on. Someone said they understand that they get gas and bloating symptoms from FODMAPs, but they wanted to know, do true food allergies also cause gas and bloating? I'm assuming they're maybe thinking, they're trying to figure out, is there gas and bloating coming from FODMAPs, or is it coming from a true food allergy that they have?
Yeah, fabulous question. So in terms of some red flags we usually like to get ruled out when pursuing low FODMAPs would be food allergies, also inflammatory bowel disease, or some other digestive health conditions, because there's a lot of overlap. And so that's the hard thing to sometimes sort out. We know we have these symptoms, but we want to know the why as well, because we don't want to go down a totally different path if there's something else going on. And so it's a great question. It could be, and that's something you'd want to definitely get your practitioner to rule out if it hasn't been done already.
Before we go on to any other questions, I know a lot of people, we've hit the full hour mark. I want to just get everybody aligned around what's going to happen next. We're going to send out over the next few days a link to this recording, plus a whole series of resources. You will also receive something from Joe from Diet versus Disease, so that you can also be able to follow up on anything that they've presented today. And also, we just want to invite you to always stop by at FODMAP Everyday, because a lot of the questions that have been asked are actually answered over on the website. And so go and take a look at all of the articles that are there. Go and hit the article section and wander through that. I think you'll also find a lot of really helpful information, and obviously always the recipes. So thank you all for coming. And I know Joe said he'd be willing to answer a few more of the questions. So if people want to stay on for 3 to 5 more minutes, Joe, do you mind wandering through some of those?
Yeah, we'll do a quick fire, because there's quite a few, but a lot of them can have a fast answer. And yeah, make sure you check out FODMAP Everyday and all their tried and tested recipes that these two ladies have been putting together. It's definitely the best resource that I've come across, and that's why we wanted to collaborate more. So Judy Green. Oh no, that wasn't a question. Okay, Ira. Yes, I was tested and found that I have MTHFR mutation, but never really did much with that information. Yeah, the MTHFR, it was more like related to homocysteine and your risk of cardiovascular events. I don't know if it plays a role in IBS. It's definitely never been studied. Theoretically, maybe, but again, we just need to speak with you and see what's your actual symptoms. Like what's actually going on. What have you tried? Maybe we can help. I see Trisha's been commenting a bit. She did the Nerva program. So Nerva is like an app that we actually also provide our clients if they're suitable for it. It's an app that is based around gut-directed therapy, but it's like self-guided things that you do there. She said it didn't help. Insurance won't use antidepressants before giving the okay for rifaximin. So maybe she's got some sort of SIBO going on there. I don't know if you had a question, Trisha. You're waiting for cognitive behavioral therapy. I mean, the thing is, if Nerva didn't work, it might not be that gut-directed therapy doesn't work, but you might have to do it with the gut-directed therapist. That's just a reality. We do provide that service as well, but of course, if you can find someone, this is the thing. Like it's a 3-month wait and things like that. I mean, yeah, that's kind of that's up to you. But obviously, we're sort of doing it so you can jump any queues. Does gut-directed therapy have a large meditation component? I feel like if I answer this, I will butcher the way that I should. I want to say that it does, but it's not meditation. It's hypnotherapy actually, and I'm sure they're actually very different things. But to me, like to someone who's not super well trained in that area, it can appear sort of the same in the beginning, but it's not. Let's see who's got a question here. Claire, how long do most people need to work with you to sort these issues out? Their issues out. So Claire, it depends. We've so many different options. We typically say 16 weeks, but some people don't need that long. Some people just do 8 weeks or something like that. I definitely wouldn't promise anything less than 8 weeks. So 8 weeks is a really good way you can get started and try to learn everything you need to know to continue on your own if you so choose. But 16 weeks, we can usually sort everything. Yeah, gut-directed therapy. Do you mean gut-directed hypnotherapy? Yep, exactly. And how to restore your gut after having a colonoscopy? Well, if you're just talking about because you took some of those drinks and it sort of cleaned out your bowels, you can just go back to normal eating. Like with that context, I can't really answer that question, Ryan. Julie said she's been her GI doctor didn't tell her about low FODMAP. She's been doing this herself. It's not working on my own. Yeah, Julie, you should contact us and we can see if we can help you out. You don't have to do it by yourself. Linda, I've used Michael Mahoney's IBS audio program. I've heard of that. That's like one of the classics. But should I continue to use it when things flare up? That I can't answer. I'm not sure. It depends on what caused the flare up. I don't think it would do any harm. I don't know if it will be helpful. Christina says the dietitian needs to be FODMAP Monash trained. Yeah, it certainly helps. Everyone on our team is FODMAP Monash trained, I think, right, Taylor? Or
yeah, I believe everybody is.
Yeah, I'm pretty sure.
Yeah, I think so.
Kathleen said, will this work for SIBO? So the FODMAP diet has a place in treating SIBO, absolutely. But typically first you're getting tested, you might have some sort of antibiotic treatment like rifaximin or neomycin or something like that first. And then there definitely has to be some diet changes and you need to do a little bit of exploring there. And we do sign up many SIBO clients and work with them as well.
I just wanted to jump in.
Yeah.
We're actually going to be publishing an article pretty soon about why to work with a registered dietitian. And certainly, especially in the US, we know that finances come into play. Many times working with a dietitian is not covered by insurance, but we can tell you that it actually ends up being an economical way to go. Because if you think about all the diets that you've started and stopped, all the foods that you've bought and then realized were wrong, supplements, the hundreds of dollars worth of supplements that you've gone and invested in and then realized that they weren't working or maybe even making things worse. And possibly worst of all, the time, right? Just spinning your wheels, like trying a new regime, not working, trying a new regime, not working. And the months go on and you're still experiencing these debilitating IBS symptoms. And, working with a dietitian like Joe and his team is really the most direct way to getting to where you want to be. And it can end up being economical in the end.
Mm-hmm. Yeah. Thank you for that, Dede. And also the time it saves you. Time is the most important currency, I think. You never get it back. So just reflect like, if it was a year ago and you're sort of in a similar situation, 2 years or 3 years or 5 years, how much longer are you willing to go down that road, right? So just consider the time and its impact as well.
Well, Christina just said, she says, all the doctor visits, co-pays, deductibles, ER visits. Oh my God, we've all been there. This program was worth it for me. So, one of your testimonials, just one of your many testimonials.
Yeah. Great.
Excellent.
Good. Okay. Well, I'm mindful of the time. Maybe we should wrap it up. If there are other questions, we could definitely I think Zoom keeps all the comments and questions as well. So if there's any like repeat ones, we could probably answer them after the fact in email for you guys.
Great.
Definitely.
Wonderful.
Thank you all for joining. Thanks for dealing with my technical difficulties at the beginning. Glad Joe pointed that out.
And we really appreciate everybody showing up and participating. And Dede and I work really hard at choosing resources and services that we stand behind personally. And so we're really grateful that both Joe and Taylor were able to join us today. And you can also read more about their services also on FODMAP Everyday. And so we hope to see you guys again next time, because we'll be sure to do another webinar. So we hope everybody has a good rest of their day. And always, we love to hear from you. So you always can hit info@FODMAP Everyday with any questions or comments that you may have as well.
Thank you, everyone.
Excellent.
Thanks, everybody.
Thank you, everyone.